The 3TO brace offers quick and effective help for ingrown, involuted and deformed nails. This 3-piece wire brace is hooked under both sides of the nail rim, which enables the tension of the 3TO loop to gently lift the nail upwards. This immediately relieves painful tissue and allows the nail to return to its normal and straight growth. The 3TO brace is available in several types, depending on the thickness and the width of the nail. There is also a special 3TO brace for persons allergic to nickel. The 3TO loop is also available in different strengths. The arms of the brace each have an S-curve to which the loop will be attached later on. They also have an omega, which serves as a spring element and a bracing support. All instruments required for treatment with the 3TO brace must be cleaned and disinfected before each use, corresponding to hygiene regulations. Apart from the side-cutting nippers, all instruments can be cleaned in a sterilizer. The arms of the brace also need to be disinfected prior to each use. Always wear gloves during treatment and take the appropriate safety precautions, such as wearing a surgical mask and protective glasses, for your own protection and that of your patient. Before treatment, the entire treatment area must be disinfected thoroughly. To do so, use either skin disinfecting spray or the appropriate skin disinfectant wipes. Clean the nail fold before you put on the brace. Make sure you do not create any unnecessary irritations while doing so. Clamp the first arm of the brace into the fixation pliers right at the omega. In order to bend the arm of the brace slightly in preparation for its adjustment later on, gently pull the wire over the handle of the winch hook. Now measure the length of the brace arm. You will need to leave a space of about 5 mm as a connecting area for the 3TO loop in the middle of the nail. In order to bend the little hook in the wire that will be placed under the nail rim later on, bend the wire over the round side of the 3TO combination pliers until you have a U shape. Choose your desired hook size from thick to very thin from the 4 holes in the 3TO combination pliers. Then place the hook facing upwards into the desired hole of the 3TO combination pliers and press them shut firmly. The hook must not protrude from the pliers, but rather must be completely in the hole. It must be bent round enough, because an open hook may lead to injuries when the brace is positioned under the nail. Finally, turn the pliers back a little in order to prevent the hook from being dented. Then cut the hook short. The arm of the brace is cut off from the rest of the brace right behind the S-curve. Use a diamond nail file to deburr the end of the wire. Now use the fixation pliers to grip the S-curve brace arm. Adjust the arm of the brace to the curve of the nail surface by using the round side of the 3TO combination pliers. The more you adjust the curve in the wire to match the curve of the nail you are treating, the easier it will be to attach the brace later on. Disinfect the brace. Hold the fixation pliers with the clamp brace like a pencil and pull back the nail fold a little. Now insert the brace arm from above into the nail fold. The hook is now parallel to the nail fold. Press it downward gently and turn it at 90 degrees under the nail. Place the brace arm on the nail with the omega pointing toward the nail bed. If the brace arm is not lying closely enough to the nail, or if the hook is causing discomfort, remove the brace and adjust the bend in the hook. The second brace arm is prepared in the same way and hooked under the other side of the nail. Now the 2 brace arms are connected using the 3TO loop. Push the winch hook into the small part of the loop. Then place the large loop around the S-curves of the brace arms and push them together slightly with your fingertips before twisting the 3TO loop. While you are twisting, make sure you keep the loop under tension all the time. This way, the wire will remain in the middle and will be twisted evenly. Do not let go of the brace arms throughout this process. Check if the brace is firmly in position on the nail. The patient should not be feeling a strong tension on the nail, nor should they be in discomfort or pain. Trim the wire ends of the 3TO loop and the S-curves. In order to preserve your side cutting nippers, always only cut one wire at a time. Place a finger over the wire while cutting it to prevent the ends from flying off. To seal the 3TO brace, apply a drop of Pedigel with a spatula and mold it over the wire ends. Activate the 3TO microlamp and harden the Pedigel by lighting it for 20 seconds. Hold the microlamp at the lowest possible distance over the area to be sealed. During hardening, a smeary layer will form on the surface of the gel. You can easily remove this with a moist swab. Any nail corners that are causing discomfort must be removed. Then plug the nail fold or treat the wound. To remove the brace, loosen the seal with the side cutting nippers and cut the loop in two. The arms of the brace can now simply be taken away.